Doctors rarely talk about this, yet research shows over 60% of women after 60 could restore their libido in just weeks if they understood one biological truth: desire doesn't fade with age, it fades with neglect. I'm Dr. Eliza Hart, a board-certified gynecologist with over 15 years of experience helping women through menopause and hormonal transitions. And today, you'll learn exactly how to increase your libido after 60 using medical evidence and real-life steps you can start tonight. For decades, women have been told that desire naturally disappears with age. But biologically, that's not true. After menopause, lower estrogen and slower circulation simply change how the body responds. They don't erase the ability to feel. Most women never learn how to adapt to these shifts, so they confuse biology with aging. I've seen countless women in their 60s restore passion once they understood what their bodies were asking for: better blood flow, hormonal balance, and emotional safety. With the right medical steps, desire isn't gone. It's waiting to be reactivated. So if you've been feeling disconnected or quietly believed intimacy is behind you, stay until the end. I'll share 6 medical and psychological steps proven to increase libido after 60 safely and naturally. Before we begin, subscribe and comment. 1. If you're ready to understand your body through science, not shame, and help me reach 10,000 subscribers so this channel can grow and support more women like you. 1. Step 1. Restore circulation. Blood flow first. Before we talk about hormones or emotions, we must start with the foundation. Every cell in your body depends on circulation. Most women don't realize that after menopause, blood flow to the pelvic region decreases by nearly 40%, and that drop quietly affects sensitivity, energy, and even mood. The result isn't the loss of desire itself, but rather a lack of oxygen and nutrients reaching the tissues that once responded easily to touch. In clinical terms, it's not aging that silences desire, it's poor circulation. The encouraging part is that this is entirely reversible, and improving blood flow is one of the most effective medical ways to restore libido naturally. When I see my patients struggling with low desire, one of the first things I examine isn't their hormone levels, but their cardiovascular health. The same arteries that deliver oxygen to your heart also feed your pelvic organs. When those vessels stiffen from inactivity or poor diet, the body simply forgets how to respond. But when circulation improves, the spark returns almost automatically. Research from the Mayo Clinic confirms that women who engage in moderate physical activity at least 5 times per week report a 25 to 30% improvement in sexual satisfaction independent of hormone therapy. This proves that movement is medicine. To start, aim for 30 minutes of brisk walking each day. If you can't walk outdoors, light indoor exercises like stair climbing or stationary cycling work just as well. Include gentle stretches that engage your hips and lower abdomen areas most affected by reduced blood flow. Combine this with pelvic floor training squeeze and release the pelvic muscles for 10 repetitions 3 times a day. These small habits activate microcirculation, strengthen pelvic muscles, and retrain your brain to send signals of arousal again. You'll notice changes not only in physical sensation, but also in confidence posture and energy levels throughout the day. I once treated a woman in her late 60s named Carol, who believed she was too old to feel anything. After 6 weeks of consistent walking and pelvic training, she returned saying, "I didn't just move my legs, I woke up my body." What her story shows is that desire isn't dormant, it's waiting for movement. When oxygen and blood return to your tissues, pleasure follows. And once circulation begins to flow freely again, the next step becomes even more important, supporting your hormones so they can respond to that new energy. 2. Step 2. Balance. Key hormones naturally. Once circulation improves, the next vital step is to balance the hormones that govern your body's natural rhythm of desire. Hormones are not abstract numbers on a lab test. They are messengers that shape how you think, feel, and connect. After menopause, estrogen levels can drop by up to 60%, and testosterone, the hormone responsible for vitality, confidence, and motivation, declines steadily as well. This shift alters how your brain perceives pleasure and how your body reacts to touch. Many women assume this means their sexuality has ended, but medically, it simply means the communication between hormones and the nervous system needs support, not replacement. In my years of practice, I've seen that the women who restore their libido most successfully are not those taking high-dose hormones, but those who rebuild balance through small, consistent choices. Start by nourishing your body with foods that provide the building blocks of hormones: omega-3 fats from salmon or flaxseed, healthy cholesterol from eggs and avocados, and minerals such as zinc and magnesium from nuts and dark leafy greens. These nutrients help your body synthesize estrogen and testosterone naturally. Drink plenty of water. Dehydration alone can intensify fatigue and reduce vaginal comfort and limit caffeine and alcohol, which elevate cortisol, the stress hormone that directly suppresses desire. Equally important is sleep. During deep sleep, your brain releases luteinizing hormone, a key trigger for estrogen and testosterone production. When sleep becomes shallow or fragmented, this natural cycle breaks. Aim for at least 7 hours of quality rest each night and try to maintain a consistent bedtime. For women struggling with hot flashes or insomnia, techniques such as paced breathing or magnesium supplementation can significantly improve sleep quality, which in turn enhances libido. Some women may benefit from medical support. Low-dose vaginal estrogen or microtestosterone creams, when prescribed responsibly, can restore tissue elasticity and energy levels within weeks. Always consult a physician experienced in menopause management before starting therapy. This is not about chasing youth, but restoring comfort and function. One of my patients, Linda, age 64, came to me exhausted and convinced that my body has forgotten how to feel. We adjusted her diet, restored her sleep schedule, and introduced a mild estrogen gel under supervision. Within 2 months, she noticed not only physical change, but also emotional stability. Her laughter returned, her energy lifted, and her confidence followed. That's what hormonal balance truly means, not a shortcut, but a harmony between biology and self-awareness. And once this inner chemistry begins to stabilize, the next focus is addressing comfort, because when the body feels safe, desire can finally express itself again. 3. Step 3. Improve vaginal comfort. Now that your hormones are beginning to find balance, it's time to address one of the most common yet overlooked barriers to desire: physical discomfort. Many women assume that loss of interest means emotional distance or hormonal failure, when in truth, it's often the body's way of signaling pain. After menopause, thinning tissues and reduced natural moisture can make intimacy feel irritating or even painful. The brain quickly associates that pain with fear, and once fear takes hold, desire shuts down. In medicine, we call this a conditioned avoidance response, and it's entirely reversible once comfort is restored. The first step is to rehydrate and heal the vaginal tissues. Regular use of a pH-balanced vaginal moisturizer 3 to 4 times per week helps repair the mucosal lining and improve elasticity. These products are not lubricants, they are medical moisturizers that rebuild tissue health over time. During intimacy, use a high-quality water-based or silicone-based lubricant to reduce friction and help retrain the brain to link touch with pleasure, not discomfort. If dryness remains severe, discuss localized estrogen therapy or DHEA suppositories with your gynecologist. Both are scientifically proven to restore natural lubrication and increase blood flow without significant systemic effects. I've treated hundreds of women in their 70s who thought intimacy was permanently out of reach. Once we managed dryness and tissue health, many rediscovered pleasure within weeks. One patient, Maria, had avoided physical closeness for years out of fear of pain. After 3 weeks of using a vaginal moisturizer and gentle stretching therapy, she smiled during her follow-up visit and said, "It doesn't hurt anymore. I actually look forward to it." That transformation had nothing to do with age and everything to do with comfort and confidence. From a neurological perspective, when the body stops associating intimacy with pain, the brain reopens pathways of anticipation and reward, dopamine and oxytocin. The neurotransmitters of connection begin to rise again, helping both partners feel emotionally closer. Remember, comfort is not a luxury. It's a biological prerequisite for desire. When your body feels safe, your mind allows pleasure to return naturally. And if this message resonates with you, take a second to interact. Tell me in the comments what you'd like me to cover next, or share your own experience. Your stories and engagement help me create better evidence-based videos for women over 60. And don't forget to subscribe so together we can keep breaking the silence around women's health and bring these conversations into the open. Step 4. Reconnect emotionally with safety. Physical comfort lays the groundwork, but emotional security is what truly awakens desire. For women, intimacy begins in the brain long before it reaches the body. The limbic system, the emotional center that governs bonding and attraction, requires a sense of safety before it allows arousal signals to flow. When stress, resentment, or emotional distance accumulate over years, this system grows quiet. I've often seen couples who love each other deeply, yet feel like strangers. The issue isn't love lost, it's connection interrupted. Restoring that connection is one of the most powerful non-medical ways to reignite libido. To begin, shift the focus from performance to presence. Start by sharing appreciation daily, even for small things. A meal cooked, a gesture of kindness, a shared laugh. Emotional recognition releases oxytocin, the bonding hormone that enhances trust and relaxation. In studies from the Journal of Sexual Medicine, couples who practiced verbal appreciation for 2 weeks showed measurable increases in oxytocin and reduced cortisol, the stress hormone that suppresses sexual response. Simple acts such as holding hands, making gentle eye contact, or sitting together without distraction signal safety to the brain. These moments tell your nervous system, "I'm not under threat," which is the biological permission your body needs to respond again. If emotional distance has grown, begin rebuilding through honest communication, but with softness, not confrontation. Replace "you" never or "you always" with "I miss when we used to." This small linguistic change transforms blame into invitation. Emotional reconnection is rarely about fixing a problem overnight. It's about rebuilding trust through consistent kindness. Even 10 minutes of genuine conversation each evening can change the hormonal landscape of a relationship. I remember Susan, a 70-year-old patient, who came to me saying, "We talk about everything except what really matters." She and her husband began what I call the nightly 10 minutes of uninterrupted conversation before bed. Within a month, she reported feeling emotionally lighter, less anxious, and more open to touch. Her body followed her emotions. The moment her heart felt safe, desire returned naturally. Once emotional safety is reestablished, it becomes the bridge between body and mind. Desire no longer feels like an effort, it becomes a response. And as that connection deepens, the next step will help you strengthen it further from within by rebuilding confidence and a positive relationship with your changing body. 5. Step 5. Rebuild confidence and body image. Even when hormones stabilize and emotional connection returns, many women still struggle with one silent barrier: the loss of confidence in their own bodies. After 60 changes in skin muscle tone or weight can distort self-perception, making intimacy feel intimidating. But from a medical and psychological standpoint, confidence is not vanity, it's physiology. The way you perceive your body directly influences how your brain releases neurotransmitters like dopamine and oxytocin, which regulate both mood and arousal. When you look at yourself with criticism, your brain activates the amygdala, the stress center. But when you view your body with acceptance, that same brain releases chemicals of calm and curiosity. Rebuilding confidence begins with reestablishing sensory awareness. Spend a few minutes each day reconnecting with your body through gentle, intentional movement. This could be stretching in the morning, a slow walk at sunset, or even applying body lotion with mindful attention. These small physical gestures stimulate the sensory nerves under the skin and signal your brain that your body is still responsive. Over time, these sensations reshape the brain's map of pleasure and self-worth. Science supports this. Studies in neuroplasticity show that repeated positive sensory input can literally rewire neural circuits tied to body image and desire. Beyond the physical, redefine what beauty and femininity mean in this stage of life. Your body has carried you through decades of work, love, and resilience. It deserves appreciation, not comparison. Choose clothing that feels comfortable, yet elegant fabrics that invite you to move freely. Avoid dressing for who you were at 40. Dress for who you are now, a woman who understands herself more deeply than ever. One of my patients, Karen, 66, confessed that she avoided mirrors for years. Together, we worked on small sensory rituals, breathing, stretching, and self-care routines. 6 weeks later, she said, "I didn't change my body. I changed how I saw it." That shift alone reawakened her confidence, and with it came renewed desire. When you carry yourself with quiet assurance, your partner senses it too. Confidence isn't loud. It's a steady physiological signal that your body is open, grounded, and receptive. It transforms not only how others see you, but how your own brain experiences pleasure. Once that confidence becomes part of your daily rhythm, you're ready to reinforce it through one final biological key, learning how to calm your mind so your body can respond with ease. 6. Step 6. Calm the mind to activate the body. The final step in restoring libido after 60 is learning to quiet the mind so the body can speak again. Most women underestimate how profoundly chronic stress interferes with arousal. Elevated cortisol, your body's main stress hormone, acts like a biological brake, suppressing estrogen, testosterone, and dopamine. Even if circulation and hormones are improving, persistent mental tension keeps the nervous system in fight-or-flight mode, making relaxation and desire almost impossible. Understanding this connection is not philosophy, it's neurology. Your brain must first feel safe before it allows the body to feel pleasure. Start by carving out 10 minutes each day solely for relaxation. This doesn't need to be elaborate meditation. It can be as simple as slow-paced breathing before bed. Inhale deeply for 4 counts, hold for 2, and exhale for 6. This breathing pattern activates the parasympathetic nervous system, the body's natural recovery mechanism, and immediately lowers heart rate and cortisol levels. Research from Harvard Medical School has shown that women who practice daily deep breathing for 6 weeks saw measurable reductions in stress hormones and improved blood flow to the pelvic region. When calm becomes a routine, circulation and arousal begin to synchronize effortlessly. Gentle movement also helps quiet the overactive brain. Try restorative yoga or slow stretching, focusing on the lower back and hips. These movements release endorphins that not only elevate mood, but also enhance body awareness. Limiting caffeine and alcohol, increasing hydration, and ensuring consistent sleep will further support this neurochemical balance. Even small adjustments like lowering evening screen time or spending a few minutes outdoors each morning can recalibrate your body's natural rhythm. I recall Jean, 72, who came to me saying she felt numb not only physically but emotionally. She began with nightly breathing exercises, then added gentle yoga twice a week. By the 6th week, she reported feeling calmer, sleeping better, and unexpectedly feeling a warmth returning she hadn't noticed in years. Her experience illustrates a truth I've witnessed countless times. When the mind slows down, the body remembers how to respond. Calming the mind is not about detachment. It's about creating physiological space for desire to surface. When your body no longer fights stress, blood flow, hormones, and emotions work together in harmony. At that moment, intimacy stops feeling forced. It becomes natural again. And as these 6 steps unite circulation hormones, comfort, connection, confidence, and calm, they form the complete foundation for a healthy, fulfilling desire at any age. To help you put these steps into action, I've created a simple 6-week plan designed for real life, not perfection. The goal is to help your body, hormones, and mind gradually align again. In the first 2 weeks, focus entirely on movement and circulation. Walk briskly for at least 20 minutes a day, add light pelvic floor exercises, and drink more water than you think you need. As oxygen and blood flow improve, you'll start noticing subtle changes in energy and mood. During week 3, begin adding hormone-supportive foods, avocados, eggs, olive oil, salmon, and dark leafy greens while maintaining a regular sleep schedule. Avoid skipping meals as stable blood sugar directly supports hormone stability. In week 4, shift attention to comfort. Choose a good vaginal moisturizer and use it consistently. Combine it with lubricant when needed. Don't wait for discomfort to appear. Prevention is far easier than correction. Week 5 is about connection. Dedicate 10 minutes each night to talk openly with your partner or simply share quiet time together. These moments rebuild trust and stimulate oxytocin, which enhances both bonding and desire. Finally, week 6 brings everything together. Practice deep breathing before bed. Stretch your hips and lower back and let stillness replace overthinking. Notice how relaxation amplifies everything else you've built: blood flow, hormonal balance, and confidence. This isn't a race. It's a gentle recalibration of your body's natural design. By the end of 6 weeks, most women report clearer energy, deeper sleep, and a quiet sense of aliveness returning. It's proof that pleasure and vitality don't belong to youth, they belong to anyone who takes the time to care for their body with consistency and curiosity. Restoring libido after 60 is not about chasing youth. It's about understanding the body you live in today. Every step you've taken, from improving blood flow to balancing hormones, healing discomfort, rebuilding confidence, and calming the mind, forms a complete medical foundation for healthy desire. The process is not instant, but the science is clear. When circulation improves, hormones rebalance, and the nervous system feels safe. Pleasure returns naturally. Your body was never broken. It was simply waiting for care, attention, and the right signals to awaken again. As a gynecologist, I've witnessed women in their 60s, 70s, even 80s rediscover vitality once they began treating desire as part of overall health, not a taboo. My advice is simple: be consistent, be patient, and never feel ashamed to discuss your needs. Intimacy is not a luxury. It's a reflection of emotional well-being and physical vitality. Prioritize sleep, hydration, gentle exercise, and honest communication. These are as important as any medication. Above all, approach your body with curiosity rather than judgment. The more compassion you bring to yourself, the more easily your body responds. Thank you for spending this time with me and for caring enough about your health to seek knowledge instead of myths. If this video has helped you, please subscribe, share it with another woman who might need to hear this message, and leave a comment below to tell me your thoughts. Your support helps this channel grow and reach more women worldwide. Together, we're proving that confidence, connection, and pleasure have no expiration date.